Thanks for meeting today for the ER department. We want to talk about keeping our department safe and the patients safe whenever they come into our department. So we're going to avoid violent aggression. We want to have a goal of no physical or chemical restraints used on our patients. And we are going to be the #1 contact for these patients when they come into the room. Nobody else will know their history. They will just come into the room and boom, there we are, getting to deal with this. We're going to have to stay safe as well as the patient. Per Tischler, we want to have a calm, inviting atmosphere. So we need to have that with trained professionals on hand. And the reason we need to have a calm environment and trained personnel is to avoid any more irrational aggression, violent episodes. 40% of our psychologists have been assaulted on the job. So that's 1 in 5 that get physically assaulted by their patients. So many of our new jobs, and many are new to the jobs, and they need more experience, and we need to be trained on the warning signs of how to care for these patients. A lot of times we're not going to know when they first walk in how the whole visit's going to go. So we need to have safe surroundings, and we need to know how to work and train with these patients. We don't know if it's drug use, if they're septic, if they're ill, if they're in withdrawals, what would they be coming off of, if they've had head trauma. But of course, if you smell alcohol on their breath, you can pretty much think that there's going to be an episode of violence coming. Per RUV, we need to look for the signs of agitation, guarding, combative posture, threatening remarks, irritability. So we look for all these signs in the patient to try and triage and figure out what is going on and how we can help them. We need to learn to see this before it escalates and we're in a bigger problem to deal with. So the environment has to be adequate. We need to have enough staff around to avoid any situation. We need to avoid overcrowding. If these people come into an atmosphere and it's overcrowded, it's hot, it's sweaty, it's it's a real small, crowded room, that's about to make anybody escalate, especially if they're in pain, if they're having violent episodes, if they're just irritable to begin with. Per Richmond, also, we would also need to avoid loud noises, extreme paint colors, just kind of keep a calm atmosphere of no bright colors, no obnoxious smells, no extreme temperatures, limit projectile type lamps. So just kind of being aware of what the surroundings are, make sure it's calm and easy to deal with. Makes a person calm instead of feeling irritable. Like I say, the goal again is patient safety and staff safety. So we want the patient to be in control of their own actions. They will feel much better if they are in control. Our body language is going to be key to helping them be calm and work with the aggressive patient. We have to be trained to talk to these patients, to collaborate relationships with these patients, and to verbally de-escalate the situation. So lots of training on our part. So per Bagian, the Joint Commission recommends assessing all areas of concern. So we need to have layered levels of security. We need to have, say like guards that are around that are maybe not in the proper guard clothing, so like plain guardsmen. We need to have HR that goes through all the training processes for our nurses, our doctors, our lay people. So everybody needs to have all the right training to go through this process. Per Antonsomy, we have to use a trust strategy to talk and work with the patient. So just being able to sit down and to be in a calm atmosphere, to talk to the patient, to gain their trust, to let them know that we are here to help them, to work with them calmly, So we need to basically lead by example. We need to let them know that we will not put up with aggressive behavior. We need to be firm on that. We need to be confident in that, and we need to be consistent in that. So we need to have a timeline to come up with a plan for keeping our department safe, and that timeline should be, given from right now. We should have 4 weeks. So within 1 month, we should be able to get some proper trainings and maybe some video training out for our staff. Let a few of the HR and some security do some walkthrough through our department, and maybe we could, maybe do some rearranging of the furniture and seeing what we can do to help. I believe in about 1 month we can meet. So if we're meeting on a Wednesday morning right now, we can meet 1 month on a Wednesday morning. We can all sit here and discuss through feedback of our department people what they think and what they see of improvements in our department. So let's work on the first 2 weeks of rearranging furniture, making sure we don't have projectiles around, making sure that we are getting the training out to the public, and then we need to be able to start evaluating that before we meet next time. So thank you very much, everybody, for meeting. Appreciate it. Please put your feedback in, and we will see you next week in 4 weeks. Thank you. Bye.